Hi, Green River Gators. My name is Deb Casey. I'm the Vice President of Student Affairs. The COVID-19 crisis has upended life for all of us. It's impacted our health and our safety on a daily basis. As the COVID-19 crisis continues to unfold, drawing lessons from history on resilience and recovery can inform a proactive response, improving our future and the well-being of all of us. While this crisis is not the first at Green River that we have encountered, the nature and the magnitude differs for us as a college, requiring us to think outside of the box on ways we can continue the continuity of our mission for the college and support the safety of every student, employee, and visitor coming to campus. As the COVID-19 pandemic developed back in February, the college's Emergency Operations Center, the EOC, which consists of employees representing a number of stakeholder areas of the college, was activated and has since formulated planning for the foundation of how we are going to respond with a phased-in approach to reopening our campuses. In addition, a campus-wide reopening committee has also been formed to work alongside the EOC in developing strategies and recommendations for the EOC to consider and for subsequent policy decisions to be made. As the college embraces the new normal resulting from the COVID-19 health and safety crisis, Green River's community has remained steadfast, and it's our top priority in the college's planning. The following training is governed by the latest health recommendations from the state of Washington, as well as from the Center of Disease Control and Prevention. The provision of a safe environment for the pursuit of learning has long stood as a Green River value. The college intends to employ this safety culture as a critical component of the mitigation strategy regarding COVID-19. The college will advance the safety culture and campus life to foster support of the public health measures to direct behaviors necessary for advancing a safer community. The college will use a vibrant approach to changing norms associated with community protective measures. Physical and social distancing, face coverings, increased hygiene, and reduction of behaviors that impact our community. The college eventually will return to operations, but it is dependent on all of us doing our part to follow the college's health and safety plan and notifying appropriate college officials when concerns do arise. I want to close by emphasizing the importance of individual responsibility. The health and the safety of the college is a collective responsibility for all of us. All students, faculty, staff, vendors, volunteers, and visitors are subject to the college's policies, procedures, and oversight. The college's mitigation strategies are predicated on emphasizing individual responsibility for implementing recommended personal level actions, empowering departments and community partners to implement recommended actions, particularly in a way that protects persons at increased risk of severe illness. The reopening protocols of our college are designed to promote a safer and healthier environment for teaching, learning, and working. I'm honored to work as the Vice President of Student Affairs, and I am committed to the health and the safety of all members of the campus community. I ask you to please take seriously the following training protocols in order to mitigate the spread of the COVID-19 virus. I appreciate all of you and the work we do together to protect our community. Go Gators!
The current coronavirus outbreak has dominated our lives since late 2019. This outbreak is a new type of contagious virus for which, as of yet, there is no vaccine. The virus causes a disease called COVID-19, which stands for Coronavirus Disease 2019. Like most people, you may be concerned with how this affects us globally, locally, and personally. Our video will briefly cover specific action items that each of us can do to make us as safe individually and as a community as a whole. We have taken our information from a variety of sources, but mainly from facts established by the U.S. Centers for Disease Control and Prevention, better known as the CDC. We will be focusing on these main areas of interest in combating COVID-19. There is currently no vaccine to prevent coronavirus disease 2019. The best way to prevent illness is to avoid being exposed to this virus. The virus is thought to spread mainly from person to person, specifically between people who are in close contact with one another, about 6 feet. through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. Some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms. How can you protect yourself and others from COVID-19? Our goal here at Green River College is to give you practical steps from the CDC to prepare yourself against the transmission of the disease and to show you the importance of practicing everyday measures that can help prevent the spread of the disease. Everyone should avoid close contact with people who are sick. They should social distance, also called physical distancing. This means putting 6 feet of distance between you and non-family members. Remember that some people without symptoms may be able to spread the virus. Keeping distance from others is especially important for people who are at higher risk of getting very sick, such as people over 60 years old or people with underlying medical conditions. Next, you should stay home when you are sick, except to get medical care. Cover your cough and sneezes with a tissue. You should also avoid touching your eyes, nose, and mouth with unwashed hands. Next, clean frequently touched surfaces and objects daily using a regular household detergent and water. Next, wash your hands often with soap and water. Wet your hands with clean, running water, warm or cold. Turn off the tap and apply soap. Lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. Need a time? Hum the happy birthday song from beginning to end twice. That's about 20 seconds. If soap and water were not readily available, use a hand sanitizer that contains at least 60% alcohol. Now, it's especially important to wash before eating or preparing food, before touching your face, after using the restroom, after leaving a public place, after blowing your nose, coughing, or sneezing, after handling your mask, after changing a diaper, after caring for someone sick, and after touching animals or pets. Also, it is imperative to take care of the emotional health of yourself and loved ones. If children are involved, be aware that they respond differently to stressful situations. Talk to them about the outbreak, stay calm, and reassure them that they are safe. Discourage children and teens from gathering in public places to slow the spread of COVID-19. A key component of your safety plan in combating the COVID-19 is the use of face coverings. As of the making of this video, the use of face coverings is required while physically on any of the Green River College campuses. The CDC has released new guidelines for the use of face coverings to help slow the spread of COVID-19. According to the CDC, cloth face coverings should fit snugly against the side of the face, be secured with ties or ear loops, allow for breathing without restriction, be laundered and dried without damage or changed to shape. Now, you should wear a face cover in public where it is difficult to maintain social distancing. The mask's purpose is to protect other people in case you have COVID-19. The mask is not a substitute for social distancing, which is, again, about 6 feet from other people. Masks should not be placed on young children under age 2, on anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Green River College is dedicated to cleaning and disinfecting your study and workspaces. Our goal is to use cleaning practices from the CDC and industry standards for cleaning and disinfecting areas. Faculty and students will have protocols in their classrooms and workspaces to help facilitate these standards. This includes cleaning and disinfecting frequently touched surfaces daily, such as tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilet faucets, and sinks. If surfaces are dirty, use detergent or soap and water prior to disinfection. Then use a household disinfectant. Most common EPA-registered household disinfectants will work. Transmission of the virus to persons from surfaces contaminated with the virus has not been documented at the time this video is being published. However, current evidence suggests that viruses may remain viable for hours to days on surfaces. Here's a list of symptoms provided by the CDC. Fevers or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Symptoms usually show up between 2 to 14 days after contracting the infection. Symptoms are usually mild and begin gradually. Some have no symptoms at all. COVID-19 usually begins with a fever and dry cough. Most people have mild symptoms and get better without any special care. It's good to remember that most of us get infected with coronaviruses at some time in our lives. They usually cause mild to moderate upper respiratory infections, resulting in symptoms much like those of a common cold, but can cause more severe illnesses such as bronchitis and pneumonia. Please screen yourself at home for these symptoms before coming onto any of Green River College campuses. If you are sick, stay home. If someone is showing any of these signs, seek emergency medical care immediately, such as trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. If these symptoms occur, please call your medical provider for any of these symptoms or other symptoms that are severe or concerning to you. Those at greatest risk for developing a severe or lethal case of the COVID-19 are those over 60 years old or living in a nursing home or long-term care facility, and those with underlying conditions such as hypertension, diabetes, cardiovascular disease, chronic respiratory disease, severe obesity, and cancer. With children, the symptoms are relatively rare and mild. If you feel unwell, stay home and call your local health professional. If you have shortness of breath, seek professional help immediately. To find comprehensive news, updates, research, and recommendations concerning COVID-19, visit the websites of the U.S. Centers for Disease Control and Prevention and your local health department. While more is learned every day, there is still a lot that is unknown about COVID-19 and the virus that causes it. Green River College is trying to give you the best available information to date to help each one of us come up with a practical safety plan to help protect ourselves and others. We know that this pandemic can induce a tremendous amount of stress on anybody, and we want you to know we have resources here at Green River College to help you in your emotional well-being. Please visit Green River College's website that can show you counseling and other resources during this trying time.